Hi dear students, welcome to ardentmds. The topic in front of you today for discussion is pitch, roll and yaw in orthodontics. So this is very small topic but apparently most important topic and lot of weightages have been given for this topic in almost all competitive examinations. Okay, and this topic also is like not so much of given importance during UG curriculum. So this topic is given a special importance for PG entrance preparations. So this concept is not found in all the textbooks, but apparently it is taken from an article from the journal called American Journal of Orthodontics and Dentofacial Orthopedics in 2007, authored by Dr. Ackerman and Profit and Server. So this is directly picked from an article from the journal AJODO from 2007. So what is this pitch, roll and yaw, and from where these terminologies have been taken? So basically these terminologies are meant for aerodynamics. That is, if we consider an aeroplane can move forward, backward, can also move upward and downward. It also can move in right side and left side as well. Apart from this common direction, an aeroplane can also move like this way. That is in takeoff direction, landing manner, can also rotate like this right side, left side, and it can also change its course of direction by just tilting its nose. So an aeroplane has 6 way of navigation in order to cruise over the sky. Similarly, in orthodontics also, the classification can also be made in other dimensions as well. So there comes the importance of terminologies, that is pitch, roll and yaw. So before going to orthodontics, let us understand what exactly the meaning of pitch, roll and yaw. So all these categories have been classified in 3 coordinates, that is x, y and z axis. So for example, this is the horizontal plane and this is the vertical and this is the 3-dimensional third dimension of the coordinate, that is z axis. So this is x, this is y coordinate and this is z coordinate. So an aeroplane can rotate along these three rotational axes. Similarly, the mallocclusion can also be categorized on these 3 rotational axes. So this is a correlation between the aerodynamic terminology which has been correlated in orthodontics by these authors. Right. So what is a pitch? Pitch is nothing but, let us discuss in terms of aerodynamics as well. So when a plane just goes on runway and it takes off, okay, in this way, that is, this is the nose of the aeroplane. So when the nose of the aeroplane is facing upward or facing towards the sky, this is called pitch up. Similarly, when the aeroplane is about to land, it may tilt its nose down to approach the runway. So this is called pitch down. So this is called pitch up and this is called pitch down. Right. Coming to next terminology, that is roll. Roll is nothing but an airplane should turn right side or left side in order to navigate through the skies. So it can turn in this way or can also turn like this way as well. So this is called rolling of the plane or roll of the plane. Similarly, in orthodontics also, a maxilla can either roll right or left. Let us see that in subsequent discussions. So this is called rolling of the plane. Whereas this is called pitch of the plane. That is, the nose part of the plane can either go upward or downward during takeoff or landing. That is called pitch. And the turning the direction of the airplane by just making one wing down, other wing up, either right or left side is called rolling of the plane. Then comes a last terminology. This is called yaw. So an airplane can either turn right by tilting the wing right side, or it can also just change its course of direction by turning its nose either right side or left side. So this is called yaw, Y-A-W. So this is called yaw. So just a quick recap, we have 3 terminologies, that is pitch, roll and yaw. Pitch is nothing but taking the nose of the airplane either upwards or downwards is called pitch. Okay, and roll is nothing but changing the course of direction by tilting the wings in right side or left side is called roll, and this is called as yaw. This is also one of the way of changing the directions. Now by having understood this concept, let us just correlate the same thing to our orthodontics. Let us see what we have. So this is the different views of a maxillary cast. So this is the proximal view or sideways, this is the frontal view, and this is the occlusal view. Okay, let us just correlate what is pitch, roll and yaw in this cast, right? So this is proximal view of the cast. So if this view is taken upward like this, so this is called pitching up. That means to say that if anterior teeth is pushed upwards, it's called pitching up of maxilla. Or if the maxillary anterior teeth is tilted downwards in this way, this is called pitch down of the maxilla. Right. Now let's move to next image, roll. So here the maxilla cast can either roll like this way or that way. So what happens, one side will be least developed, one side will be developed more. So what we have is, we'll be having a canting of occlusal plane in case of roll, right? Very simple, right? In case of yaw, maxilla can either turn this way or this way. So what happens is like, there will be a change in dental and skeletal midline deviation in case of yaw. Okay, just again to quick recap, a pitch is nothing but tilting of occlusal plane either excessively upward or downward is called pitch up or pitch down of maxilla respectively. Coming to roll, tilting of occlusal plane either right side or left side in upward and downward direction is called roll. And tilting of occlusal plane when viewed from occlusal aspect either right side or left side will lead to change in the dental midline. So this is called yaw. So let us have some lively illustration. So let us assume my fingers as an anterior teeth. That is, this is my index finger is a lateral, my middle finger is a central, and my ring finger is a central, my little finger is a lateral. So what is pitch up of maxilla? This is called pitching up of maxilla, and this is called pitch down of maxilla. Okay, so we should be very precise in naming the terminologies. That is, pitching down of anterior maxilla, pitching up of anterior maxilla, or the same way can be put in other way around, pitching down of posterior maxilla. Both are the same, right? Now this is called rolling of the maxilla. Rolling of the maxilla in right side, rolling of the maxilla in left side. And last, that is yaw of the maxilla. Yaw of the maxilla towards right side and yaw of the maxilla left side. And assume this is my midline. Okay. So when yaw is happening, what happens? Midline of the maxilla or the midline between the central incisors is getting shifted either towards right side or left side. So very simple concept, just pitch, roll and yaw. If this concept is understood very clearly, any type of question can be answered in a confident manner, right? So let us see some clinical examples. This will make us to understand a little more in clear way. So let us see the first image. Here the child is smiling, but apparently we are not seeing any crown portion of the tooth, only gingiva is seen. So what happens in this patient? So if I am smiling in a wide manner, all my incisors should be seen. That is the ideal smile aesthetics, right? But in this case, the incisors are not seen at all. So what had happened in this case is, there is a pitch down of maxilla. That is, all the incisors are synced down or tilted down. The whole entire maxilla is tilted downwards. That's why the incisor is not seen at all and only gingiva is visible. Okay, so in this case, the patient is having a pitch down of anterior maxilla. That's the reason the incisal portion or coronal portion of the teeth is not visible at all, right? Just focus on this image. Here a proper coronal portion of teeth is visible, but when we look very carefully, what happens is the gingival portion is increasing as we go down posteriorly. So what happens is there is a pitch down of posterior maxilla. I will repeat again. When we see in the frontal view, the gingival display is very less in the frontal view. But as we go posteriorly, the gingival visibility is increasing, which means to say that the maxilla is pitched down posteriorly. So, in this case, maxilla is pitched down anteriorly. Here, the same thing had happened, but in posterior region. That's why the gingival visibility is increased in posterior region. Okay, so this is the classic example of pitch. Coming to roll. So what I told the meaning of the roll, rolling is nothing but it can either tilt right side or left side. So just focus on this clinical scenario. Here, when you put a line along the incisional tips, what happening is like we are seeing a cant. Okay, that's why just focus on the gingival visibility of this patient. In patient's left side, gingiva is least visible, whereas in right side, much amount of gingiva is visible. So what had happened is in this patient is maxilla is rolled down towards patient's right side. Okay, so this is a classic example of rolling of maxilla. Yes, these are the classic example of yaw. Just what I have drawn is the facial midline, and just focus on the dental midline. So here is the midline of the dental midline of the patient, and in this case this is the dental midline of the patient. What had happened in these patients? Here in first image the maxilla is yaw towards left side, and second scenario the maxilla is yaw towards patient's right side. That's the reason the dental midline is not coinciding with the facial midline, right? So now we understood what is pitch, roll and yaw, how it will be expressing in clinical scenario. So now we'll come to a special segment called Rnflash. Just kindly go through it once. So whatever we spoke now has been summarized in a single slide. So we have three terminologies known as pitch, roll and yaw. So what is a pitch? Pitch is nothing but excessive upward and downward displacement of dentition without tilting, or just the dentition goes up and down in bodily manner. So that is called pitch. Coming to roll, roll is a roll of either line along horizontal axis up or down on right or left side. So this is called roll. And coming to yaw, the rotation of maxilla or mandible around vertical axis of rotation, which leads to either class 2, unilateral class 2 or class 3 along with changing the midline dimension, right? So this is the pitch, roll and yaw. And one more thing important note in yaw is what exactly happens in yaw is the whole maxillary dentition turns either left side or right side. So what happens is like when for example when the maxilla is completely turned towards patient's left side, what happens to a molar relationship? The molar on the right side will come to class 2. Why? Because when the maxilla is rotating towards left side, the molar moves forward. So there will be a class 2 on one side, on the other side there may be class 1 or super class 1. What is super class 1? It is nothing but a stage between class 3 and class 1. So when the whole maxilla is turning towards left side, that is yaw, what happens is there will be either unilateral class 2 or unilateral class 3, right? So yaw will magnify as unilateral class 2 or class 3 malocclusion as well. And unilateral posterior crossbite also accompany more severe yaw. So when there is a crossbite only on one side, in those cases also yaw will be magnified in a huge manner. So this is all about pitch, roll and yaw. Now let us go for some review questions pertaining to this pitch, roll and yaw. So this question is asked in All India PG examinations. So in case of anterior deep bite, what will be seen? Very simple and clear cut question. In case of anterior deep bite, what is anterior deep bite? That is increased overbite. Okay, increased overbite is called anterior deep bite. So in case of anterior deep bite, what is happening? That is pitching down of maxilla is taking place. Which part of maxilla? Pitching down of anterior part of maxilla is taking place. So the answer is downward pitch of maxilla is the right answer. So of course, pitch, roll and yaw will be pertinent to mostly in the case of maxilla than the mandible. So you can omit the options of mandible. Just focus on the maxillary options as well. Upward pitch of maxilla is not, will lead to open bite, whereas downward pitching of, this is downward pitching, right? This downward pitching of maxilla will cause anterior deep bite. Okay. Transverse cant of occlusion when seen facially is described as, so this is called canting of the occlusal plane. So this is nothing but rolling of the occlusal plane. So transverse cant of occlusion will be seen when there is a roll, right? In case of anterior open bite, what will be seen? Just now we discussed. In case of anterior open bite, what happens is there will be a upward pitch of maxilla, upward pitch of anterior maxilla or downward pitch of posterior maxilla, in either of the way can be called as, right. The rotation of the jaw or dentition to one side or the other are on vertical axis, right. We have an horizontal axis, we have vertical axis. So when we rotate our jaw around the vertical axis, our jaw can rotate like this only, okay. So this is how the jaw will rotate along the vertical axis, and this is called as yaw. So what happens when there is yaw? When yaw is taking place, first thing is there will be a change in midline. There will be a non-coincidence of dental midline with skeletal and facial midlines, and there may be a either unilateral class 2 or class 3, and there are also chances for severe unilateral posterior crossbites as well. Okay, unilateral class 2 or class 3 might be associated with what just now we discussed, yaw. So only in case of yaw we will be having either unilateral or unilateral class 3 malocclusion. So I hope this session was useful, and this is very important topic, short and crisp topic, which is given much of weightages in many of the examinations. I hope this concept is made clear. Have a happy learning. Thank you.